Is Joe Biden healthy enough to be the president of the United States? That's a conversation that a lot of people have been engaging in, especially since the release of the special counsel's report that calls into question President Biden's memory. I'd like to take a moment and go through some of the reported health history. Last year, the physician to the president released a health summary. I'd like to talk about that a little and try to have an objective analysis of what we know of the president's health and maybe carry that out into a little bit of a speculation as to what it might mean for the upcoming year and possibly a second term. I'm trying to do this not in a political way, either for or against him, but to just try to objectively look at the various issues, known health issues, and then some of the things that we've been seeing, everybody's been seeing with their own eyes. In doing this, I'm bringing my experience as a registered nurse who has worked with hundreds, if not thousands, of patients that are in the same age and stage as President Biden. I'm going to be building a lot on my own experience and what I've seen and what seems to happen with people in Joe Biden's situation. I can't diagnose anything. I'm not a doctor. I'm a registered nurse. And likewise, I don't see him every day and don't have that up close enough look to be too specific because there's just some things I don't know. But I do want to talk about what we do know. And we're going to start with the physical health issues that I see, and then we'll move to the mental health and the cognitive issues. So if you stick with me, we'll get to those cognitive issues and talk about them in a clinical way. Back in February 2023, you'll remember that there was a health summary released by the White House, and we're going to use that as our basis for discussion, bring in other things as we go along. The first thing to note is that President Biden did have the pandemic virus. Don't want to be too specific with the words there because I still don't know how YouTube flags things or suppresses things based on certain words, but I think you know what I mean when we talk about the virus, the pandemic virus. He had that in the summer of 2022. However, it looks like he's fully recovered, and the physician talks about no long-term symptoms coming out of having the virus. Sometimes with people in advanced age, will have long-term health issues as well as health compromised people, but it didn't seem to happen with him. When we get into his main health issues, there are some areas of concern, and I want to talk about them. I would love to be more descriptive and go on more, but as I was mapping it out, I don't want a 30-minute video, so we're just going to have to keep it short and brief, and you can use Dr. Google to go ahead and get any more specific detail that you may be interested in. First to note, we saw in his report that he has non-valvular atrial fibrillation, and it's a chronic atrial fibrillation. So what is atrial fibrillation, or you might just heard it called AFib? It's when the top chambers of his heart, the atria, and the lower chambers, the ventricles, are kind of out of sync with each other when it comes to beating. And this kind of condition places somebody at much higher risk for stroke. That's why he's on apixaban, which is an anticoagulant to keep the blood from clotting that may not be having difficulty getting through his heart. So that anticoagulant is to reduce the risk of stroke. But I've noticed in people over age 80 that stroke is still a very real possibility, even when there is some treatment, some anticoagulant treatment. It doesn't take away all of that risk. The other risk of atrial fibrillation is it is hard on the heart, and it can lead to heart failure. So people with AFib often will go into heart failure, and that can often come on quite suddenly. And when it does come on quite suddenly, you can see a rapid decline. So when we looked at all the kind of causes of atrial fibrillation, it wasn't because of leaky valves or anything, but one of the major causes of non-valvular atrial fibrillation is sleep apnea, which in summer of 2023, the White House acknowledged that President Biden has sleep apnea and does wear a CPAP mask at night. And sleep apnea is a breathing disorder when your breathing abruptly stops and starts. That is another condition that is very, very hard on the heart, just like atrial fibrillation. And because of those things and those things together, being 80 years old, that puts him at very, very high risk for developing further heart failure. And that heart failure, as I think I said before, can come on rapidly and can cause a very, very rapid and significant decline. Furthering that is, I saw in his report that he has what the doctor called mild peripheral neuropathy. Neuropathy is kind of the hands and feet, weakness, tingling, pain that's coming from the nerves just not working the way they should be. And it was noted that the typical causes that are usually there, like diabetes or B12 deficiency, oftentimes goes along with alcohol abuse, or thyroid deficiency. He has none of those, which makes it even more concerning in a way, because I've seen peripheral neuropathy like that just in clinical practice. Somebody will be having that, and that's often a precursor to further heart failure. So we're seeing three things: the atrial fibrillation, the AFib, we're seeing the sleep apnea, and we're seeing the peripheral neuropathy. All of those things can kind of tie together to create a much greater risk of heart failure, and that heart failure could come on quite suddenly. And also the AFib can put him at a much higher risk of a stroke. And having a stroke at his age can have real significant consequences. So that's the first kind of part of what I would say of his health condition that should be concerning, especially for somebody over age 80. And if you put all three of those together and you look at different research by the National Institutes of Health and others, right now, you could say, based on studies, that he has about a 62% chance of not being alive at his next birthday, just giving those kinds of conditions kind of grouped together. That's not saying it will happen. One of his benefits and strengths is he's got great medical care right there. I'm sure if anything happens, the staff at the White House and the medical staff is going to be all on top of everything to minimize the impact of any further health complications that might come along. There is another set of things that's concerning to talk about in his health record of spondylosis. That's kind of the wearing down of the vertebrae and the neck, the cartilage and bones that can create that stiffness. That's why he kind of leans forward and walks more stiffly as that disease progresses, and it's very much age related. You're going to see him have less flexibility. They also noted degenerative osteoarthritis, which takes the protective tissue between the bones and the joints and everything starts to wear down. It gives a lot less flexibility. And then you add to that age-related muscle degeneration. You add to that the neural decline that happens as our body is not making those neural cells as much and regenerating those. And there's some neural cells that once we've lost them, we've lost them. And those are probably the longest living, our neural cells. Some of them last a whole lifetime. Most other ones are going to die and regenerate over like a 4-month period or 6-month period. And when we get older, that regeneration process just doesn't happen. So you see less and less muscle tissue and the like. So that makes for somebody that's very unsteady on their feet, very frail looking when they're walking, very high fall risk. And that is really important because we have a president and we've seen him fall. He loses balance easily and it gets progressively worse. What I'm concerned about is the fact that a fall, given his state and his osteoarthritis and his spondylosis, could lead to a significant break in a bone, like on his spine or in his pelvis or his hips or his femur. And I've seen patients his age time and time again simply not recover and actually decline very rapidly with a major bone break, a fractured skull. Things like that would just happen really quickly. And since he's also an anticoagulant for his atrial fibrillation, he's also at a very high risk of maybe falling and hitting his head or in the abdominal area where he would fall and cause an internal bleed that wouldn't be readily apparent. And it's through that internal bleeding would be happening. And by the time people realize what was happening, it may be too late. So there's a very, very high fall risk. And yet I still do not see the White House and the staff really guarding against these issues. He should be using a cane or a walker to walk or human assistance to help keep him steady whenever he walks anywhere. I would not let him just be walking up to the podium like he does because the risk is so great for this fall that could cause a fatal fracture. And it wouldn't be the fracture that would lead to the end of life. It's all the other things that follow out of that fracture and the stress that can put on the body, or the fact that you could have an internal bleed that you're not aware of because he's on an anticoagulant and it may not be readily apparent. It may not bruise up like people would expect to see. And by the time they realize he has a bleed, it could be too late. So we want those fall precautions. The other thing is, because he has AFib, when he's standing up and he's talking for a longer time, that puts a lot of stress on his heart. And if his heart's in AFib, you're going to see confusion and weakness and lethargy, and you're just not going to see him look right. That's why when he's giving these speeches and he's standing up rather than sitting down, when he has to exert all his energy to get to the podium rather than be wheeled up in a wheelchair, that can put it into a state where he's going to make more confused statements. He's not going to be able to read the teleprompter well. It's because he's overexerting himself and his brain is not getting the oxygen that he needs. And he's already at his age going to have that mild cognitive impairment, or what we would call senility. He's already going to be more slow on his feet to begin with, and now you put the strain on his body, which makes him even more difficult for him to speak and think clearly. And I think that's another problem. I would hope the White House would just bite the bullet and say, you know what, he's got to give speeches sitting down. When we take him places, we need to bring him in a wheelchair. If he's got a little bit of a walk, he needs to walk with human assistance or a cane or a walker. We're going to put a less strain on his body as possible because he just needs that assistance now. But apparently, for political reasons or whatever, they're trying to create this appearance of health and strength and vigor, and it's not really working out for them very well because they're not taking into account the physical conditions that he has and how we treat them and how we help people be successful with helps when you advance in age and you have these limitations. He could be much more clear, I think, and much more successful in his communication and everything if they just wouldn't put so much strain and pressure on him. But that's just my thought, looking from a distance and seeing how we would normally treat other people in his condition that I would know more personally one-on-one, and how we would help them be successful in the age and stage of life that they're in. Now let's talk about the cognitive decline. And that's the thing that everybody's talking about, right? That he gets confused, he loses track of the teleprompter, he doesn't realize that he's reading stage cues on the teleprompter rather than it's something to be read. He's slurring words, he's forgetting places and things and everything, and everybody's saying, oh no, the president can't function, the president can't, he's demented, he's got dementia, he doesn't have a clue where he is, or all those things. And I would say that this is probably an overstatement based on my experience with hundreds, if not thousands of people that are developing dementia, have dementia, or are seeing the end of life related to their dementia, that it's probably a little overstated. Part of the problem, and part of what normally happens is as we get older, we do have some mild cognitive impairment. We are slower on our feet. It takes us longer to think things through. But that does not mean that we've lost our mental faculties, that we've lost our ability to make decisions. It means that we just have got to approach somebody that's older a little differently. They're not going to be thinking quick on their feet all the time. They're not going to be able to absorb new information quickly and make quick decisions. There's got to be a lot of discussion back and forth and things like that. So we don't want to expect somebody that's 81 years old to make quick decisions, to think quickly on their feet. But there is, you see this age-related cognitive decline, and it happens at different times for different people. Some people really find cognitive limitations in their 70s, some in their 80s, some are really sharp into their 90s. And the question is, where is President Biden? And it seems to me that he's beginning to show these signs, just like when you watch his gait, how he walks, how he's more shuffling, more stiff, more frail, and how other things seem to be showing this increased rate of decline. We have to be thinking about that rate of decline. And so one of the scales that we use as nurses is called the FAST scale, or the Functional Assessment Staging Scale. It was developed by a doctor named Barry Reisberg in the early 1980s. It's for Alzheimer's patients, for somebody with a diagnosis of Alzheimer's. But we find it as a scale can be useful for people with other forms of dementia and cognitive decline to measure their functional capability. This is not a scale so much to determine the cognitive ability, like a Montreal scale and things like that. This is just to look at functional scale, functional ability, and that functional ability is often tied to cognitive ability. And it begins with fast stage one, there's no limitations. When you get to stage two, you find somebody is forgetting where things are. I can't find my wallet, can't find my keys. What did I do with this? What did I do with that? They have no recollection of something that they may have set down. They might not have any recollection of other objects. And sometimes they have trouble coming up with finding the right words to say. You'll see them hesitate because they're just not finding the words, just not coming to them. So that's stage two. You begin to notice, oh, so-and-so, it's, they're forgetting things and words don't always come to them. They're still functioning on a pretty high level. But then we get to stage three. That's when you start to see the ability to organize work. It gets lost a little bit. It's hard for them to go to new places and meet new people because it's involving a lot of processing new information. And when you have that cognitive decline, what's hard is to process the new information. That becomes very, very difficult. Then after that, you get a stage four. Now they're losing the organizational capacity. It's harder to process new information. Now it becomes harder for somebody to perform more difficult tasks that involve a number of steps. For example, grandma who always was able to carry off Thanksgiving dinner. Now she gets to the point where she's overwhelmed and she can't plan a Thanksgiving dinner anymore because it involves not only meal prep, it involves communicating and all those different things. So it becomes difficult. It could be that mom and dad are having trouble managing finances. You find a property tax bill stuffed away somewhere, never opened, and those kinds of things happen. There are these multi-step things, balancing a checkbook, paying bills, and everything becomes more difficult. So somebody that's, we look at these stages 2, 3, and 4, so how they would work out for somebody like that's the president that has lots of people around them. Some of these stages are not going to be as apparent because they're already going to have people that are going to plan things. There are already people that are going to know where things are, that are going to help them find things. There are already people that are going to plan and organize events and activities and things where he just has to be the decider. He has to show up and decide and get reports and kinds of things like that. There are already going to be staff around to do these more complex tasks. And probably in his home, I imagine the First Lady and others that are working in the White House residence are helping him with all these things. So these limitations probably aren't going to be as apparent to the White House staff or even to his family because he's got so much support and help in the right along. So these 2, 3, and 4 stages, if he's going down this cognitive decline, it's going to be more masked and more covered. But I think part of the reason why they are so protective of him is because where he is probably most vulnerable is in situations where he's answering questions, where he has to take in new information, process it, and come up with an answer. And that's why they want him to read the teleprompter and not go off script. Because whenever he does, it's difficult for him to take in that information and quickly process it and come up with an on-the-spot answer. They would rather be able to take in those questions and begin to help process with him so he's not having to make those quick assessments. And so I think that's probably some of what's going on wherever he is in cognitive decline, is they're trying to not put him in a situation where he has to take in new information, process it, make some decisions, make some connections on his own, because he might not be able to do that very well right now. He needs the input from staff and others to help him make decisions, just because he's not going to be able to process it that quickly on his own. So he could be possibly, maybe, and it would be the staff and his family that would know this more than anything, somewhere between stages 2 and 4 on the FAST scale. He may even be somewhere in 5. And 5, you're beginning to be less aware of your surroundings, and that typically is reflected in the clothing. That's kind of the FAST scale. That's kind of the functional test that helps people decide on that. So wearing winter clothing in the summer, putting summer clothing on in winter, wearing daytime clothing at night, nighttime clothing at day, just not able to process and understand, and it's reflected in clothing choices, that he may not be able to understand where he is and what's going on and what's appropriate and what's not. Again, the White House staff and his family is going to cover for a lot of that, so it might not be very apparent to us. But it seems to me that kind of confusion and that lack of awareness, I know people are picking on him a lot, but he still does seem to show and have some awareness of what's going on around him and able to interact on some certain level. So I'm not sure that I could even call it a FAST 5 just based on what I've seen. And I know people like to pick on him, but I really, really don't think he's gotten to the point where he has such lack of awareness of his external environment that it reflects on his choices. And FAST 6 begins to start to reflect on an internal choices, internal awareness. it reflected in the inability to dress yourself, inability to have proper hygiene, to use the bathroom properly, to shower properly, to make sure that your clothes are washed and cleaned, and things like that. So somebody at a fast scale 6, which is a second to last scale, they're losing the ability not only to process the outside world, but they're losing the ability to process their own internal environment and recognize things that they should know and be able to handle. And that's where you see incontinence and other things come up. And it gets to that point where they're incontinent, they're just not aware, and they may be talking, and there may be a rhythm to it. And just to point out that somebody can't carry on conversations, but they can't process new information. So for example, somebody in this scale might be so used to, hey, how you doing? I'm doing fine. How's the weather? Weather's nice. These chit-chatty conversations that they've done all their lives, they can do that. There's a certain rhythm. But then when you throw them new information, they'll either get agitated or they'll go silent because they don't have the ability to process what you just gave them. So as long as you're engaging in social convention and nicety and politeness, or in the case of a politician, if you know how to do political speak and the same political speak that they've done for 50 years, they may be able to engage in that, but they're not able to engage and process new information, things that they've never had to think about before. It would be difficult for them. When you get to stage 7, that's the last stage. Usually when somebody's in stage 7, they have less than a year to live. Often it's 6 months or less to live. And that's when they lose their ability to speak coherently. It's unintelligible speech. They often won't speak unless you talk to them or disturb them. They'll just sit silently. They'll lose their ability to walk. They'll lose their ability to sit up. They won't be able to smile. They won't be able to hold their head up. These kinds of things in the 7th stage really indicate the last 6 months of life, usually. And most often, especially in cases of Alzheimer's, the scale works much, much better than it does with other kinds of dementia. But when we get to those stages, people are less able to function. Now, as I look at his cognitive impairment, that's impaired from public things, it's hard to know exactly fully where he is. But I do not believe that he's at the stage yet where he cannot take in information and given the time and help to be able to adequately think through situations and scenarios. I do think it's getting to the point where he's not going to think well on his feet. He's not going to be fast on his feet. He's not going to be good in a debate. I do think that there's lots of vulnerabilities about putting him out there just to take questions. But I do think he's still, from what I've seen, probably is able to make decisions and think things through with the help and the guidance of his staff, which presidents do all the time. But the question is, where are we going to be a year from now? Where are we going to be 2 years from now? Just like the questions with the heart, possible heart failure, with the high fall risk and the risk that comes with that. Also these cognitive risks. To me, it's a big chance the Democrats are taking and putting him in the situation where he has to be the standard bearer going into the convention, which is 6 months from now, going into the election, which is 9 months from now, and then even being inaugurated, which is that's 11 months from now. That these changes could happen so rapidly that they're not going to be prepared for the Joe Biden that's going to be there 6 months, 9 months, or 11 months from now. And that is a big, big risk I think the Democrats are taking. But that's a political thing. That's what they're doing. But I really do feel that there is a lot of risks with Joe Biden being president and running for re-election that a lot of people really need to seriously think through. And I don't think they are. I think they're just hoping for something where science, medicine, statistics all say that they're facing an uphill battle, whether he will be fit and ready or even able to function come the election. There's no guarantee. I think that's something that really needs to be discussed and hasn't. Let me know what you think in the comments. I'll try to respond as often as I can. Thank you. Have a good day.